Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level.
Good morning and welcome to the Veterinary Rehabilitation Podcast. It is so good to have you with us today. Today I am chatting to Dr. Paul Brumett from MediVet Product, and we dive into the wiggleless back brace, how it works, how it stabilizes the spine, when we might want to use it, when we might not want to use it, and so much more. We are so excited to have MediVet Products with us at the Vet Rehab Summit. Come and join us live to learn more from them. Before we jump into the interview, I want to say a big thank you to our sponsor for the podcast, Paw Prosper. Paw Prosper believes that true pet well-being demands a three-pronged approach: prevention, support, and rehabilitation. Their brands are trusted by veterinarians, universities, and rehabilitation facilities alike. So whether you're looking to train, rehabilitate, or help your patients age gracefully, brands like Walking Pets, Help 'em Up, Respond Animal Therapeutics, Fit Paws, Muffins Halo, Sleepy Pod, and Canine Carts, they all offer effective, innovative, and proven solutions. Sign up today to receive a special gift for all our Online Pet Health listeners with your next order. You can sign up using the link pawprosper.com/OPH. Over to our interview. Hi guys, and welcome. Hi Dr. Paul, thank you so much for joining us today.
That's my pleasure.
Awesome. Guys, so today we have Dr. Paul Brumett from Wiggleless Back Brace and from MediVet, yes. And we're going to be speaking about back bracing and the biomechanics behind it. This is such an interesting topic. I think from when back braces started to become available for dogs, we've really been talking about how we could be implementing them. There are some concerns with their use, and there are some really awesome opportunities with their use. And I think if we have those conversations and we continue to look at it clinically, they can be a really valuable tool. So I'm looking forward to going into that. So if you guys are joining us live today, it is so good to have you. This is one of our Vet Rehab Summit prelims. We are getting warmed up for the main event on the 8th of November. We cannot wait. So Dr. Paul is actually one of our sponsors, or MediVet is one of our sponsors, and we're really excited to have them there. So instead of asking you today to introduce yourself, Dr. Paul, I'm going to be asking you a couple of fun questions. Are you ready?
Yeah, bring it on.
Awesome. If you could design a brace for any animal, real or mythical, which would it be?
A dragon.
A dragon? That's a good one. What's one thing most people get wrong about bracing?
I think there's a lot of misinformation about bracing and sores. The development of sores comes from an improperly fitting brace. And so if you go through the correct process of getting the things that we need to make one, that we decrease that level by a large percentage. And then it's really important to monitor those patients. That's how you prevent, when you start to see the beginnings of an issue, then we can help you manage that right away. But I think there's this thought out there that all bracing causes damage to the skin, and it's not that way. We splint dogs' legs all the time, and they do great, right? Because we figured that out and we know how to do that. And I think part of the potential problem is probably just that the practitioners don't understand everything that they need to be able to manage an animal in a custom device, and we're here to help them do that so that they don't have those issues.
Oh, I love that. Thank you very much. All right, I'm going to ask you a few quick fire questions. So it'll be A or B, and you choose the one that appeals to you the most. Okay. Small dog or large dog?
Oh, I would have said large dog 10 years ago, but small dog now.
Oh, I like it. Back brace or knee brace?
Oh, knee brace.
Knee brace.
Just because that's what I do the most of.
Okay.
That's what we consult the most of. But the back brace has a lot of phenomenal uses and possibilities.
Okay, I like that. Reading or podcasts?
Oh, reading.
Reading. Summer or winter?
I used to be a winter guy. I live in Colorado, so skiing's really important. But as I've gotten older, I think I like summer more.
Okay. City life or country life?
Country.
Country. Do you like the oceans or the mountains?
Oh, yes.
Yes, both.
Yeah, yeah. So I live close to the mountains, but it's fun to go to the ocean. Yeah.
The ocean. I like when I can have both in one place. Oceans and mountains together.
Yeah, there's some islands that way, I think.
Yeah, we have some coastlines here in South Africa that are very mountainous that combine both.
Yeah, I guess the northern coast of California is kind of that way in places.
And Cape Town, actually, I never think of Cape Town, but that is exactly what Cape Town is famous for, the ocean plus the mountain. Yes. Cool. Okay. Fantastic. Guys, if you are joining us live, it is so good to have you. Welcome. We have Dr. Paul Brumett here. We are talking about back bracing. So let's dive into it. How do back braces influence spinal stability and function? Because I think that is the primary question.
Yeah, so I think the first thing you have to think about is what is the function of the spine. So we all know that it contains the nervous system and it protects the nervous system. And then there are areas where the nerves come out to supply organs and muscle tissue and give feedback to the brain so it knows what's happening through the body. But it also is, what all the muscles and soft tissue organs hang off of as well and supports those. So it has to be able to flex. It has to be able to extend. We need to side bend from side to side as well. And so when you start to think about a back brace and how it works biomechanically, we have to work with those systems. And we're all familiar with intervertebral disc disease, and we see the dachshunds that the Frenchies that have bad discs as they get older, or they have misshapen spinal segments. And when the soft tissues around those start to break down, whether you lose fluid out of the disc, and so you have more movement in that space, if there becomes a weakness in the muscle tissue because of a loss of nervous system function, then the spine can no longer do its job. And so how do we prevent overflexing, overextending, too much lateral bend from one side to the other? So everybody is probably familiar with a corset. And the braces that are out there right now for dogs are really based on a corset. They're not a custom device. They're more of a device that's done for sizing. And can I use my model?
Yes, absolutely.
Yeah, so this is, let's see, we can get back a little bit. So Jack Russell model, this is an example of the wiggless back brace. And what you'll notice is that it starts at the base of the neck, and then it's going to go all the way back past the lumbosacral junction. This is probably just a little bit long for one of my patients, but if I had to go this way, I could. You want to make sure that we've got room here to allow for the back leg to move without being impeded. And then we have a system, a 3-point system, so that we allow free range of motion of the shoulder, because that's important as well. But to get to the point of the question is, how do we stabilize the spine? In a normal dog, the abdominal musculature will contract and push the organs up underneath of the spine. And that will help prevent flexion and extension. And then we have our axial muscles that help to create more musculature and strength, so that you're not doing a lot of lateral bending when you don't need to be. When those systems start to break down, then we have to put something in to control those. So what we'll have is, we call this lateral boning. So there's strips of thick plastic or metal that run along the sides across the rib cage. And then we have an elastic band that runs around, and it goes from one side all the way to the other. So that creates circumferential pressure. So that's acting like the abdominal musculature would. And so what you're doing is, if you imagine a balloon and you squeeze it in the middle, we're compressing everything. And then we have these lateral stays that keep everything from bending. When you cause that compression, the other thing that you do is you get distraction of the joint spaces. So all of those little disc spaces get a little extra width. Yeah, extra room. So that's the basics. Yeah, I mean, we can jump into different kinds of joints and what's happening in the musculature, but for me, that's the easy way to think about it, is we're helping to hold the spine in place.
Yeah, I think that's really very valuable. I've actually been just doing some studying on spinal pathologies, and what is standing out to me right now is that it is much more clinically significant for our patients when there's instability within the spine than when there's a lack of mobility, right? Like conditions that are causing the spine to fuse or to stabilize more, they're far less clinically significant than when we have instability. So I think we're sometimes scared as professionals to reduce or restrict mobility. But when we have a level of instability, this is far more valuable and useful than leaving that instability or trying to stabilize it only with the muscles and with the structures that are within the body.
Oh, absolutely. I mean, we do see some of these dogs that, if you stabilize one segment, then the other segments start to work harder. And, some of these dogs will be able to deal with that through, rehab and maintaining muscle strength, and others need some help. But I agree with you. The instability is what we're really trying to treat. If it's already fairly stable, then we're probably focusing on something totally different. There's some other compensation that they have that we need to manage.
Exactly.
Yeah.
Okay. So what are the most important clinical indicators for when bracing is appropriate?
Right. Great question. So let's talk about inappropriate first. Like the inappropriate, I would not use this on a dog that is acute and kyphotic and painful, because we've got a device that we're trying. This device is made to really kind of straighten things out. And you take a kyphotic, painful dog and try to straighten them out, and you're just going to make them more painful. So it's more of a brace that I'm going to use in conservative management after I've gotten the pain down. And certainly if they're neurologic, then they need to go see the surgeon. They need to go see the neurologist and figure out why that's happening. How to use it. There's lots of things that we've learned that we can use. Certainly intervertebral disc disease that we're trying to manage. The little dachshund who has had surgery and we're worried about other discs that we know are going to have a problem down the road, or statistically we know that might happen. Having them in a back brace when they're active, so that we feel it increases proprioception from the wrap, so they're more aware of their body, plus we're giving them stability, right? Yeah. So they're probably not going to get quite as crazy and chase the squirrel, right? Or do zoomies in it, so it protects them to a certain level. We do know that this brace, a caveat to this is if you have a dog in this brace 24/7, that they'll actually lose muscle mass. So it does its job so well that the muscles will actually start to atrophy a little bit. So you want to make sure that you're doing, from a rehab standpoint, that you're doing things in and out of the brace to help maintain your spinal musculature. Degenerative myelopathy is another use that we have seen. And I've used this for in practice. So you have these dogs that are losing their nervous system in the rear end, right? And as they take a step, they tend to sway, and it takes them a long time to recover. And when they recover, they over recover and go to the other side. So they're expending a lot of energy just to try and move forward. By wrapping their core and creating core stability, then all of that propulsion can help them move forward. So it's really interesting to see these DM dogs that are having this difficulty walking, and you put them in a brace, and it's an almost immediate effect that once you stabilize their core, they can move better. And just within a few sessions, you'll actually see them walk better. With my DM dogs, it's kind of like a dog that I would put in a wheelchair. I always try to start them out early so that they get used to it before they really need it. So that you're not introducing something. It's, it'd be like an old arthritic dog that's never used stairs, and you buy stairs for them to get in and out of your car.
Yeah.
It's probably not going to work very well. But if you teach them to do that early on, when you start to recognize the problem, then when they really do need it, it's a lot easier to use.
Yeah, I think DM is just, the change is fantastic. And I love that because you're stabilizing and you're allowing them to move in a much more controlled way, you're also protecting them from fatigue during normal activity, during walking. So that means you're getting more high quality movement for the same amount of time without moving over into fatigue, without stressing the stabilizing structures of the hips, the stifles, everything really, because they really do become very unstable. So it's a very easy way for us to provide them with stability and protect them at the same time. I think it's one of the best uses for the brace. Yeah.
Yeah. But other things that we're seeing it used for, I mean, we do have major veterinary universities that are using it post-surgically.
I was wondering about that.
Yeah. And it's in specific cases. The cases that I know of, I'm pretty sure they were like spinal fractures that had been, they went in and fixated them, and then they wanted to have something that would really hold everything in place while they healed. And that's actually one way that it's used in human medicine as well, for spinal fractures. If they're not really distracted, you just hold everything in place. But so I know that there's some universities that are using it that way. We have a researcher that we work with in Germany that is using it to dogs that have unusual gaits or compensatory gaits that they've developed. She'll put them in the brace, and the brace kind of breaks that compensation, and then she can retrain them to walk correctly. We've also had dogs that are biomechanically are using the wrong muscles to jump with. And so you stabilize their core, and then they have to use a different part of their body. And so you can train them to use their back legs correctly to help them jump. And then they can actually jump farther. So that's I haven't done that personally, but that's something that folks are thinking of and using it for. You can attach a Beco band or a TheraBand just above the ankle, and then anchor that either up to a loop up here or Velcro it to the side. And then that allows you to bring that leg forward for those dogs that are maybe have a proprioceptive deficit in their back legs. So there's a lot of things that we're just kind of teasing out what's going to really work and what's not. But you have a product. It's like all things. You have a product and you say, oh gosh, I think it'll do this and do that. And then 10 years later, people are sharing all the fun things that they've figured out how to do with it.
Yeah, I really like that. I think it's a very interesting idea to use it to break a compensatory gait cycle in order to allow you to retrain. That's something to think about. I like it. Okay, so you mentioned earlier that the back muscles could atrophy. Let's talk a little bit about that and go deeper into that, because essentially, how are we going to balance stabilizing the spine through bracing with strengthening the spinal stabilizers?
Yeah, so that comes down to rehab in my mind. So you have exercises in a controlled space on a grippy surface that tax those muscles to enough of a degree that they're firing to help continue to do their job, but to not overdo it. And of course, that's the art of practice, right? Is especially as a rehabber is learning how much to push a patient, but not push them too far. And then how to manage them if you do push them too far, because it happens to all of us. It's kind of, if you're a therapist and you're practicing and you haven't pushed a dog or one of your patients, if you're a PT, a little far, then you're probably not practiced enough. Just like I had a conversation the other day with a general practitioner, and she was talking about doing cat dentistry. And she says, you're not a cat dentist unless you break a root tip off once in a while and have to go back in for it. Right.
Yes.
But we're also very conservative and careful with those patients, right? So that if we do push them a little far, we haven't pushed them so far that they're in super discomfort. But so I think it's, we can get into specific exercises I might use, but anything that causes a little bit of imbalance that's going to cause those muscles to fire and release is what we're looking for to help maintain stability.
Okay, so you're wanting to kind of use the brace during free activity at home or controlled activity at home when they're going out on potty breaks, going for walks, whatever that may look like, when the patient is freer to move in their own way. And then when you're doing your daily therapeutic exercises for that specific patient, you're mostly wanting to do it without the brace, so that you're intentionally activating the stabilizers, strengthening the spine, and then addressing the issue through strengthening whatever that specific pathology or issue is. Is that more or less right? Or are we going to bring that back brace into some therapeutic exercise instances? Like, would we use it on the treadmill, on the underwater treadmill, for example, for some cases? I don't know.
Yeah. So yes, you're correct in your summation. The thing I would add to that is you don't necessarily have to take the brace all the way off. You can loosen the brace as well. So now it's still creating some proprioceptive input, but doesn't have as much of a stability effect. So, that's knowing your patient, right? If I've got a patient who's still pretty unstable, but I want to help maintain spinal musculature, having the brace on and having it fairly snug and asking them to do things is probably still going to make those muscles fire. But I know if I loosen that up, or if I put them on a more unstable surface, I'm going to work those muscles harder. And so then I'm going to get, I'm going to get them activating instead of staying relaxed. You can, certainly at some point, and we do this with our other custom devices too, in some cases, that you graduate them out of the brace over time. So the better they get, the stronger they get, then the less they may need it. And then we may have some that need it for the rest of their lives, right? Can you use it on the underwater treadmill? Absolutely, right? It's going to absorb the water. So when they get out of the water, you need to change it out and put them in a dry one. But if you want that core stability while they're in the underwater treadmill, you can certainly use it that way. And if you're using it, like I said, for a Beco band or a TheraBand to help draw a leg forward, to help with gait patterning or to help with proprioceptive input, then yeah, it's just, once it's wet, you just have to throw it over something and let it dry and put them in something different.
I think that's really awesome. Yeah, I love it. So let's talk a little bit about practitioner education, because understanding how to use a tool like this is really important. Yes. So where do we, learn more about something like a back brace, and why do we need to learn more about it?
Well, I think let me answer your last question first. Knowledge is power, right? If you understand why you might want to use it, whether you use it or not, or you recommend someone who uses it already to use it with your patient, once you have the knowledge, then you can use it correctly. Where do you find that knowledge? Obviously in the United States, I do lectures on this. We have online resources at medivetproducts.com and Wiggless that will kind of get you into that. We have CE events here in the United States where we talk about it. So those are probably the big things. I do not think there are some new rehab therapy manuals on the vet side that are coming out. I don't know if any of them are including back bracing yet, because it's maybe been out 10 to 15 years. So it's still relatively new. But, I always think about underwater treadmills. In the 80s, everybody was like, underwater treadmill, like, why would you put a dog in an underwater treadmill, right? And now it's like, it's like one of the big three that people have in their practice. They've got a laser, they've got an underwater treadmill, and, something else.
Yeah.
So I think as time goes by, we're going to figure out lots of other ways to use this device, and people will become much more comfortable with it. Because we are dealing with the nervous system, and I understand that. We've certainly seen those little dogs, the dachshunds that come in, the Frenchies that come in, the pitties that are screaming in pain and are neurologic, and we certainly don't want to do anything to make them worse. So I understand that, because sometimes I'll get that, like, ooh, I don't want to create damage, right? But it definitely has its place in conservative management, post-operatively and after. If you've got one of those conservative discs that you can manage medically, once they're stable, putting them in a brace, I think is a good step.
Have we got some research yet that's looking at the use of back braces, or not yet?
Yeah. So yesterday I was doing I was looking for the research that I had found recently, because there's not very much. So I'm answering a question in a roundabout way. There isn't a lot of research on the veterinary side for braces. There was one that was done in 2021 on corsets in dogs is what it was called, and it's a style just basically like what I showed you. And there are different varieties of back braces out there. They all have the same basic components: the stabilizing bars on the side and some kind of wrap. Some of them will have straps that go over the back legs as well. Yeah. What they found in that study, and I'm paraphrasing a lot, but it really didn't affect their gait, which was good, because that's always a concern, right? We put a device on an animal and it totally creates a lot of compensations. We're not helping that pet. And so what they found was that they tolerated them, and that it didn't seem to abnormally affect their gait. So that's good. Do we have any, will we ever have any high-level studies, blinded studies on, dogs with intervertebral disc disease, and if they were braced or not, and how it all comes out? Probably not. Maybe some retrospective studies, maybe 10 or 20 years from now. There's that study that's out there, and I'll be honest with you. There's another that I thought I had, and I could not find it yesterday, dealing with dog braces, but it's still in its infancy. Yeah, getting that figured out. Most of what we're doing is we're bringing over from the human side. How are they using it, and can we use it the same way?
Yeah, no, I like that. And I know Hero Braces has been for years saying, like, we will help and support research projects with the use of braces. And I'm sure with Wiggleless, it's the same principle. So can we put a call out there if anyone wants to do some research on this subject, like get hold of Wiggleless dog braces and give it a go, get it done. Let's see what we can learn and what we can find out. I think if we have at least that preliminary study that looks at is this negatively impacting the gait, that's already something. So yeah, how can we start to investigate the positive and negative effects in specific pathologies or conditions? I'd love to see some data on DM dogs, degenerative myelopathy, see how that gait is affected, because it's significant. And then what difference does that make over a period of time? If they're using those braces, is it going to help extend their lifespan? Isn't it? Is it going to make no difference? I think it's good to have that information as well.
Yeah, because right now it's just it's what we've, as practitioners, what we've experienced with our own patients, and what we share with one another of how we think, what we found works.
Yeah, which is really important. I like that. Okay,
it's how it starts, right?
Yes, it's how it starts. That's where we have to begin. Have the conversations, share the clinical experience, and get creative and experiment. I think that's one of my favorite parts of our work, is that we do get to do that. Yeah. Awesome. Guys, so we are gearing up for the Vet Rehab Summit. It is so close, around the corner on the 8th of November. We are going to have Wiggleless there. Go Hero is going to be there. All the MediVet companies are going to be there. It's going to be so good. We're talking dynamic by design. So if you have more questions about how, strength and stability and how we're using therapeutic exercises to support our patients, if you have questions around these topics, come to the Vet Rehab Summit. It is going to be incredible. Attendance this year is completely free. So it's going to take you nothing to register. Register for a free ticket. You get access to all the live events during the day. If you want to watch the recordings, or if you need a CPD certificate, then purchase a ticket or become an Online Pet Health member. Both of those are great options. being an Online Pet Health member is the better option. If you have any question, let me know and I can answer that for you. And Dr. Paul, thank you so much for your time today. It's been really interesting.
Great. Well, it's my pleasure. And certainly if anybody has any questions, they can reach out to us at wigglist.com or at medivetproducts.com.
Thank you so much, guys. Bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at pawprosper.com. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 8th of November, 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.